We'll start with our first speaker, who is Mark Schwartz. Mark is an assistant professor at the University of Minnesota College of Veterinary Medicine in the Department of Veterinary Population Medicine, and he is as well part of the SDEC. He continues his work at Schwartz Farms, and the focus of his recent and current research is PRRS surveillance.
Good morning, and thank you, Maria, for your kind introduction and welcome to our session this year. So as Maria said, the session this year, our goal is to generate discussion on knowledge gaps and barriers to control and elimination, and to have a discussion also is because the reality of disease control is the economic constraints, right? Things we work with in the field, the cost benefit, right? And so we've talked, Edison and others, on market hall sanitation and the reality of the cost of an occasional outbreak, and the finishing would appear to be implicitly less than taking additional steps in sanitation. If it wasn't, we would be taking those additional steps, right? So that's the discussion that we, in the field and in the reality of production cost benefit. Then to generate discussion on swine disease elimination and control. And so the title of my presentation, I'm kind of setting the stage for the day, is Researching the Way Out of Barriers for Disease Control. And so I've just put together, to me, a kind of a broad-based discussion and ideas, and what I see when we talk about disease elimination, disease control, and research in that end, to meet that end. So as Maria mentioned, SDEC established in 2001 to communicate knowledge of swine disease, the transmission control and elimination of swine diseases, partners, and as Maria mentioned. And so you look at how the world has changed in swine disease since the formation of SDEC. In 2001, PRRS, mycoplasma, flu, strep, TG, and dysentery on the fringe, perhaps. Since 2001, you have PCV2, you have PED, Delta coronavirus, Seneca Valley virus, and others in which our world's become more complicated in that regard. I think it's important to think, too, when we talk about eradication. Okay, there's eradication at the producer level, at the population level, at the breeding herd, the nursery, the finishing, or industry-wide eradication. And there's two entirely different topics there, and as we look at that, and so which diseases are we going to work to eliminate, and which are we working to control, right? I don't hear discussion of eliminating influenza. It's controlling influenza. PRRS control. We talk about elimination at the population level. There have been discussions at the national level, and those seem to fade quite rapidly. Mycoplasma is one we talk eradication, and successfully at the population level without doubt. And so it's one that you can undertake to eradicate mycoplasma from your breeding herds, and if your neighbor doesn't, you're still successful. So those are the discussions we have regarding elimination and control as we talk about research and barriers. So I just put up here a variety of the studies done by SDEC in the last year and a half, and I just from mycoplasma and PRRS and to Seneca Valley, and so work on, again, understanding the risks, understanding the barriers to improving our swine herd health. So as I look at this, really, when you talk about improving health and elimination and control, this quote from a paper from already almost 20 years ago from Herman and others, Munoz, Roofs, Burkhardt, and Zimmerman. And to me, this is kind of in the opening sentence of this paper, we talk about elimination, but at the most elemental level, the italics are mine, the design of effective strategies to control and/or eliminate PRRS virus depends on an accurate and comprehensive understanding of virus transmission. And so this is 20 years ago. And yes, we've learned some things, but still, I believe this is one of our limitations in PRRS and others is understanding the risks, understanding where do we put our dollars in research, where do we focus our attention if we're going to make progress. A second one that I came across a couple years ago, a 1973 paper of Newcastle disease in broilers in the UK. And this one, again, when you apply it to swine disease, I think is very appropriate. In an area where the poultry industry is dense, both in number of birds per site and the total number of sites, and again, the italics are mine, the mechanism of spread may be obscured by the multiplicity of possible routes. And so that's still what we deal with when we're working to improve our biosecurity. Again, where do we put our efforts? Where do we put our time? I've read a lot on influenza, human influenza, and I think it applies to us in the pig world. This on the right, I came across an 1820 publication, and I sent the screenshot to a friend of mine who speaks several languages, including German, and asked him to translate that cover page for me. Georg Friedrich Most, a physician from 1820, 20, 30 years prior to the germ theory, asked these questions. What is influenza? Where does influenza come from? In what ways can we predict future occurrences, and how will future outbreaks behave? And through what means can its spread be halted? And you look at that in the human field in 1820, and another publication of his from 1831 was the discussion of person-to-person transmission in this era of miasma, really looking beyond that. So a leader in thinking 20, 30 years ahead of his time at least, but very interesting. And so under Reed and John Barry or Alfred Crosby in their books on human influenza, and I look at that and say, how does it apply to us in the pig world? But you look at this and say, 204 years later, we're still asking the same questions. Another thing I bear in mind is that this applied from Talib's book, The Black Swan, and I took it from a black swan event to, for example, PRRS virus. There's a big difference between no evidence of PRRS virus and evidence of no PRRS virus. And no evidence of PRRS is this fallacy of assuming that absence of evidence is evidence of absence. And that's not the case. We work at population levels. We work with samples of convenience. Evidence of no virus is different than no evidence of PRRS virus. And I bear that in mind as I work at the population level. As we talk about researching our way out of barriers to disease control, I always bear in mind too that we live in a world of limited resources, right? With limited funding, time, people to conduct the studies, and how we direct those dollars and that time and those people. And it's the old classic macroeconomic trade-off of guns versus butter. Well, this is time spent on one project is time not spent on another. Dollars spent on something is something not spent on something else. And so as we face that reality of where we put our efforts, Maria's heard this many times. I imagine a land of free PCRs that would help us, obviously, if we didn't have to pay for PCRs. When I asked generative AI to produce a picture for me, or an image of a land of free PCRs, this is what it came up with. And so even the flying syringes. But that's the reality of the constraints, right? yeah, if that was free, we have research funding dollars, we have field staff, we have travel time, we have sample size restrictions, frequency of collection. We're working at a population level. With the exception of mycoplasma studies, which is individuals and a massive amount of time spent on those collections, most PERS research is done at the population level. And for the most part, we use samples of convenience. Again, because it's easier and simpler and allows us to get that done. This really is just, again, setting the stage for the day for all the presenters on the topics. You look at, as we work to research our way out of these barriers and how we make progress, it's collaboration, it's asking the right questions, finding the answers, and then continuing to do the work that truly matters. Thank you.